Visionary Site of the Year award was established in 2017, and it's an award that recognizes a New Mexico health system that embodies the mission of the School of Medicine at UNM in dedication to education, creating a diverse network of healthcare professionals, and providing compassionate care to all New Mexicans. The Alumni Association board felt it was really important to recognize those societies and groups throughout the state that were supporting the physicians and the sites in their work because it became so difficult this year.
As we were going through our nomination process, we do have an oversight group, the New Mexico Medical Society, that has been for as long as I've been in medicine, and I'll remember that I was a member of the class of 1973 from the medical school. I am a native of New Mexico and have always been aware of medicine in New Mexico. The goals of the Medical Society to provide advancements in medical science, even to the establishment of the medical school back in the early 1960s, has been most worthwhile. But this year, through the efforts of their technology consultants and the COVID portion of their website in giving us up-to-date, minute-to-minute, day-by-day status reports, not only clinical, but also mechanical on resources, both professional and even to the level of getting PPE for our medical providers and health systems has been invaluable. And we wouldn't be where we are, we would be a whole lot further behind without these efforts. So I ask that we nominate the Medical Society because of its contribution to the health of our state. And in particular, this year for our focus on COVID, while maintaining all of the other things that they continue to do with all of the other initiatives that the Society has, not only for the people of New Mexico, but for the physicians of New Mexico.
Thank you so much, Ashley and Dr. Archuleta, Dr. Galan, and Dr. Wright. On behalf of the School of Medicine, I am really thrilled to be able to present the 2020 Visionary Site of the Year Award to the New Mexico Medical Society. How important your work has been this year, not only for the practice of medicine in our communities, but to create an environment in which our learners across the board, be they our community faculty themselves or our learners in the medical school and our PA programs and our programs throughout the School of Medicine, are able to really benefit from the commitment that the New Mexico Medical Society has had to the health of the people of New Mexico. Particularly in these very difficult times, I think we are really, in the School of Medicine, extraordinarily grateful for your encapsulating the vision and mission of the School of Medicine in what you do. We're very, very proud to present this award to you today. Thank you so much.
Thank you so much. The Medical Society is so pleased to have this recognition from the School of Medicine. And one of the oldest traditions in medicine is that of teaching, and this goes back even to the Hippocratic Oath. And the best way for us to give back and show respect to the people who have taught us is for ourselves to teach the next generation of physicians. We recognize the importance of UNM in training the next generation of physicians and healthcare professionals in the state of New Mexico. And the members of the Medical Society are also very proud of UNM because of their medical students and their activism and the leadership that they have on the national level at the American Medical Association. So thank you very much. It means a lot to us.
I'd also like to echo how pleased we are and honored to accept this award. On behalf of the Medical Society and the nearly 3,000 members, over the past 9 months, the Medical Society has supported New Mexico physicians by sponsoring regular conferences with Secretary Scrace to provide COVID updates, as well as scientific and treatment updates. In addition, the Medical Society has advocated for financial support and housing assistance for physicians. The Society has helped clinicians and practices apply for financial relief from CARES Act funds. And I'd really like to recognize the Medical Society staff for their hard work. In addition to the staff, I'd like to recognize and thank the physicians and caregivers of the state of New Mexico who've been risking their own health to care for their fellow New Mexicans. Their dedication, caring, and bravery are inspiring, and this award is really for them. Thank you, Medical Society. Thank you, New Mexico physicians, and thank you to the University of New Mexico School of Medicine.
Carly Wujek Browning, who's an MD candidate for the class of 2021. And Carly wrote, "We did indeed work with community practitioners in Gallup, most notably the Andrades. Dr. Lawrence Andrade is a UNM School of Medicine alumni, and Dr. Tamara Gaines. We also worked with Sister Rose at Little Sisters of the Poor Gallup Assisted Living, whom Dr. Andrade graciously referred to us. It's most honorable that Dr. Andrade took extra time to help clinics and hospitals other than his own to provide medical care and get PPE. He and Dr. Gaines were crucial to our team and others getting supplies to Gallup and have worked tirelessly since the start of the pandemic. Thank you from the bottom of my heart for recognizing their amazing work and commitment." Two organizations showing exemplary courage, compassion, and dedication in service to the people of New Mexico during one of the worst public health crises in our nation's history. And the Visionary Side of the Year award goes to Protect NM and the Little Sisters of the Poor.
Thank you, Ashley. On behalf of the University of New Mexico School of Medicine, I am pleased to present the 2020 Visionary Site of the Year Award to the medical student group Protect New Mexico. Thank you for accepting this award as a representative of the community practices and physicians of Gallup working with the School of Medicine students during this difficult year. Congratulations. Rostin, would you like to say a few words on behalf of the students and Protect New Mexico?
Well, thank you guys so much. I'd like to thank the Alumni Association and the School of Medicine for their continued support. I think the efforts that we have put forward have benefited a lot of good folks, both in New Mexico as well as the Southwest region. And as the pandemic continues, we will continue to provide support to our fellow Americans. So thank you guys so much for this acknowledgement. It really means a lot.
Thank you very much. We, the Little Sisters, are very grateful for the help that Protect New Mexico was able to provide, particularly during our own outbreak here. Feeling the support of the students and not having to reach out to them, but them reaching out to us was a very big support to enable us to continue to take care of our residents.
Dr. Barrera meets the criteria for having both been a medical student and a resident. We were so fortunate to have her in both of those roles. So I have been so privileged to have known Bea for a long time. And I was just realizing, Bea, that you graduated, I think, in 2010. Is that, I mean, I can't even believe that it's been that long. But I will say that Bea was an amazing medical student and an inspirational resident. Not only has she always been just a fantastic clinician and educator, and thrown the most amazing Halloween parties that anybody ever could have thrown, but also I think really worked hard to ensure that other medical students and other residents that needed a hand up, that were having a hard time, whether it was academically or clinically, she always had their back. And she was an incredibly popular resident, but I think also somebody who really was a nurturer and who really looked out for her fellow medical students and for her fellow residents. and then, you know, she won Intern of the Year in 2007. That's given to one of our interns. So again, I think embodying the, you know, the values that we really cherish at UNM. She speaks, you know, fluent Spanish, and allowing her to connect with all of our patients. And then since she's been in practice, she's practiced in Española. And, you know, we talk a lot about our mission of caring for rural underserved communities. And Dr. Barrera is somebody who really exemplifies that commitment, really becoming embedded in a community, part of that community, and providing care along a spectrum of, you know, clinical care to spiritual care of the entire community. So when I was thinking, oh gosh, who should I nominate for Distinguished Alumna? Of course, I always ask Dr. Pareda, because she's, you know, my go-to for awards. And she's like, oh, easy, Dr. Barrera. And I'm like, of course. And so that's why I really wanted Dr. Pareda here, because I think that she so deeply understands the value that Dr. Barrera, you know, brought to medical school, brought to our residency, and now brings to the community of Española. So Bea, thank you so much for what you're doing in northern New Mexico, and really the values that you have exemplified in your life. And I know that Dr. Pareda is, you know, will share with us her perspectives and her impressions.
So first of all, congratulations. When I think about the mission of the institution, the faces that come to my mind are like just exactly like Dr. Barrera. When I first met her as a resident, I was like, this is exactly who this school like needs to be selecting. And then I just watched her sort of, you know, grow into sort of, you know, a chief, and then now as an attending. And then I actually worked for her as a moonlighter, and I just watched how she interacts with her patients, with the community, what she brings. Like her identity really is her professional asset. She always brought her whole self with her. And that's really what the community needed. The other thing is that when you're able to do that in the way that Bea does it, the community is uplifted, the women are uplifted. I hear so much now that, you know, I have clinical work in Los Alamos. I hear so much about her care. You know, I'm sending my patients to her because I want them to go and get excellent care. I'm going to be her patient, you know, pretty soon. And so, you know, like when we actually select, you know, students and residents that bring their full selves, really we're giving the women of New Mexico, you know, like an awesome opportunity to get great outcomes. And so, you know, I'm so proud of Bea. I'm just like delighted. Like I can't imagine anybody else getting this award. She's doing amazing work for that community. She takes care of all the people, like with all their intersections in the most wholesome way that I can possibly imagine. And so I'm incredibly honored to be here and to give you this amazing award. I think that as we continue to do this more, you know, we want you sort of to be part of, you know, what we do at UNM, because you are such an amazing role model for people that are coming behind you. So muchas gracias, felicidades, te lo mereces. Un abrazo.
Dr. Barrera, Bea, it's so good to see you. It's a pleasure to have you here and to have you as a double learner at our institution. We are so lucky. You completely exemplify our mission, true excellence, and you're making a difference in the world, in our state, and in Española. So thank you, thank you, thank you for everything that you're doing in the world. It's an honor. On behalf of the University of New Mexico School of Medicine, I am so pleased to present the 2020 Distinguished Alumnus Award to Dr. Beatriz Barrera. Congratulations, Dr. Barrera. And if you'd like to say a few words, we would love to hear from you.
Thank you so much for the nomination and the award. I feel like this was my calling to become a women's healthcare provider. Growing up in a rural place in New Mexico, I never wanted to be anywhere else. Even Albuquerque felt like a big city to me. My husband misses Albuquerque, but I have to say I feel like I'm home on the farm and in my small community. I take care of friends now, and I see this as my forever home unless something significantly changes. I have still been able to teach. I actually got Pi Preceptor of the Year and was celebrated via Zoom a couple of days ago. And that was awesome. I hear such, good things from students who come to Espanola, and that's what I'm really passionate about now, is having students see Espanola as a potential place for their rural care if they want to practice rurally. As the community has embraced me, and now I've embraced them as family and friends. My mom has lived with me for the last several years, and Roman's growing up, to be a farmer now, like Ricardo has become, and a hunter. And this is just, it almost was like meant to be, I feel like. So I am so grateful that I got to go to medical school and residency at UNM. I felt unadventurous sometimes for kind of just staying home always, but it was just, this was kind of my path, and I'm so proud to have graduated from UNM and be able to teach our future doctors, providers, because I'm also precepting nurse practitioners, PA students. So I really, really like to teach different types of students, and I feel like I've really come into my own out here. It was scary at first to come out here from residency to a rural location, but talk about like drinking from a fire hydrant. I learned so much so fast, and so I'm really grateful to be out here, and probably will be out here for a really long time. And so thank you again for creating me.
The true measure of the UNM School of Medicine's greatness is found in the achievements of its alumni. The Distinguished Alumnus Award recognizes an alumnus who has made significant contributions to society and whose accomplishments, affiliations, and career exemplifies the School of Medicine's legacy of excellence. I want to congratulate you on your nomination and selection for this award, and Dr. Lindsay Smart, who is the Associate Vice Chancellor for Leadership, Faculty, Diversity, Equity, and Inclusion.
Hello, my name is Dr. Lindsay Smart, and I am so excited for Dr. Gayor and her award for the 2020 Distinguished Alumni. I had the opportunity to work with Dr. Gayor as part of the peer mentoring, peer coaching experience. And I was so grateful for the opportunity to have met her and to have been able to learn from her and hear about the impact that she had on the lives of myself and also the those participants in the coaching experience. It was a meaningful experience and something that really will impact how leaders from underrepresented groups can use those skills to continue to diversify our healthcare workforce. And, I think there was one moment at the award ceremony or the end of experience celebration, and the room was full of all of these women leaders from underrepresented groups, and as a early mid-career person to see that in a healthcare academic setting was something that I don't think would impact me as much as it did, and really just highlighted the importance of the work that Dr. Gayor brought to our institution, and to highlight how much UNM is committed to really improving the leaders at our institution to be more reflective of the community. So I want to just say congratulations to Dr. Gayor, and I look forward to other opportunities to have this experience be offered across the institution and in other places, because she really has brought something that's very impactful for all of us. So thank you.
I would also like to invite Dr. Valerie Romero-Leggett to make some comments. Dr. Romero-Leggett is the Vice Chancellor for Diversity, Equity, and Inclusion.
Good afternoon. I'm actually going to share a little bit about how we nominated and what was in the nomination letter, so people will be able to understand the depth and breadth of this amazing awardee tonight, Dr. Francine Gaillard. So it was really an honor to join Dr. Lindsay Smart and our distinguished graduates of the inaugural Healthcare Leader Peer Coach Training in nominating Dr. Francine Gaillard for the 2020 Distinguished Alumni Award. Born and raised in northern New Mexico, Dr. Gaillard was the first doctor to come from the village of Cuesta, New Mexico. And at that time, only one of 3 UNM School of Medicine physician graduates from Taos County. Dr. Gaillard graduated from UNM School of Medicine in 1981 and was elected to the Alpha Omega Alpha Medical Honor Society, and then completed her medical residency at the University of Washington. Now, Dr. Gaillard is a career trailblazer in both healthcare technology and physician leadership, and I'm going to tell you a little bit about that. So Dr. Gaillard first started as a principal in a private practice group and then went on to Kaiser Permanente, and during that time led some efforts and was a leader in corporate and population health. And then after 10 years of her clinical practice, she made the leap to healthcare business and became a medical director with a healthcare technology company that was really developing the early electronic medical record. And then later, as a senior vice president for research and development for another company, Dr. Gaillard led teams that developed the earliest models of clinical data analytics. So it's like, whoa, when I found all of that out, I didn't know, because I'll have to tell you how I first met Dr. Gaillard. But even though the healthcare technology field was certainly advancing, it was really evident to Dr. Gaillard that the vision of healthcare transformation would falter without an equal effort on culture change. So anticipating the need for physician leaders who could lead cultural transformation, Dr. Gaillard embarked on her next career road to become the model leader as well as guide. And this is the part of her leadership and trailblazing that we were the beneficiaries of. So recognizing that both the success and demand for professional coaching to support clinicians, she founded the Physician Coaching Institute in 2005. It's unique among coaching schools, and this institute is now one of the most recognized and respected healthcare coaching institutes. So when I met you, Francine, I just appreciated not only your extensive experience and success as a trailblazer, healthcare executive, and entrepreneur, but just your authenticity and your sincere desire to give back to the University of New Mexico School of Medicine and develop health profession leaders, especially women and women of color. So Dr. Gaillard joined with our Office for Diversity, Equity, and Inclusion, and it was her suggestion that we enroll some UNM Health Sciences executive leaders as a pilot cohort for her institute's newest leadership development training that was called the Certified Healthcare Leader Peer Coach. And she provided her services in gratis and worked along with us to create, I think, one of the most impactful programs that you just heard Dr. Smart so eloquently describe. But I thought that the best way to understand the tremendous impact of this year's School of Medicine's 2020 Distinguished Alumni Awardee is to share excerpts from the testimonials of our outstanding HSC leaders and graduates of the Peer Coach Training. I'm going to share a few of those with you now. So Dr. Vallejo said that the coaching tools and skills that I received from Dr. Gaillard assisted me in improving my emotional intelligence, self-awareness, and coaching skills that I apply in my daily interactions. She was an outstanding coach, trainer, and mentor, and exemplified the UNM School of Medicine legacy of excellence, service, and motivation for future women leaders. And Dr. Kakari Stone said her expert leadership and guidance were good medicine for women in the health professions. Many women before have shattered the historical glass ceiling and have broken it into 1,000 pieces due to their courage, persistence, and fierce leadership. And our peer coach training community practice raised us all up through that large gaping hole in that open ceiling. And Dr. Gayor was our valiant platform to launch and fly. Dr. Gonzalez said that Dr. Gayor is a unique among physicians. Her Trailblazing Coaching Institute supports physicians as they transform their careers, organizations, and communities, and truly exemplifies the greatness found among the achievements of the UNM School of Medicine alumni. Dr. Carlette Parra said, I cannot think of anyone more deserving of this recognition than Dr. Francine Gayor. I consider myself very fortunate to have had the opportunity to learn from her. Her genuine motivation to foster underrepresented minority success has inspired me. And Dr. Carolyn Montoya said, Dr. Gayor is well skilled in mentorship for those of us who aspire to lifelong learning as leaders. And Dr. Loretta Cordova de Ortega, in our last excerpt, said, Dr. Gayor is a true pioneer and a champion for the University of New Mexico School of Medicine. Her commitment and generosity to help foster the professional growth of our underrepresented minority faculty at UNM is a testament to why she is deserving of recognition. Dr. Gayor is a true New Mexican gem and someone our institution should be very proud to honor. So Francine, your career exemplifies excellence and innovation in service to the resilience of the healthcare professionals that we rely on across the globe and especially here in New Mexico. You are muy buena gente, Francine. Congratulations.
Dr. Gayor, it is such an honor to be here with you for you to receive this award. You are such a trailblazer, as Dr. Romero-Leggett said, not just in medicine and science, but in cultural transformation, which is exactly what we need in our world today. So thank you so much for what you have done. On behalf of the University of New Mexico School of Medicine, I am so very pleased to present the 2020 Distinguished Alumnus Award to you. Congratulations, Dr. Gayor, and I would love to invite you to say a few words.
All right. Well, I am, first of all, truly honored to receive this recognition. So thank you, Dr. McGrew, for your kind words and for presenting this recognition. And thank you so much, Dr. Romero-Leggett and Dr. Lindsay Smart, for your nomination, which I was very surprised about, but I do appreciate it so much. And I also want to thank the Alumni Association for their efforts to recognize all of our UNM alumni for all of our contributions. We're all doing the best that we can, and I know there are many other UNM alumni who are out there and having an impact. You know, I also want to first say that I so much appreciate, you know, Dr. Romero-Leggett mentioned that the University of New Mexico Health Sciences Center and the Office of Diversity, Equity, and Inclusion was our first pilot for a particular kind of training that we call the Healthcare Leader Peer Coach. But I so appreciate her vision and her desire to develop leaders, not only women leaders and leaders of color, but it's a recognition that leadership, clinical leadership, physician leadership, provider leadership is so important to develop at multiple levels in the organization. And I know that Dr. Romero-Leggett and Dr. Lindsay Smart recognize that. So we had that resonance in common from the very beginning. I also want to acknowledge your thoughts around just how we develop leaders and women of color and leaders of color, because I actually learned a lot from you and from all of the participants in this training that we did. And second, I want to acknowledge that for all of UNM, all of the healthcare workers, whether you're a provider, you're a nurse, you're working in the clinical laboratory, everybody is very challenged right now because of the COVID pandemic. And whether you're on the front line, of course, many people are doing telehealth. A lot of individuals have been furloughed. A lot of individuals would like to participate, but they can't because they either have existing conditions or a family member has existing conditions. And so they really can't put themselves out in the front line. But I know this has been a very difficult last 9 months. It's going to be it'll be difficult over the next 2 to 3 months, but I appreciate everyone at the University of New Mexico, their dedication and their commitment to pulling together and doing what needs to be done in order to ensure that all of our communities in New Mexico stay safe and healthy. So thank you all for what you're doing and what you're doing for your part. So that's, you know, that's all that I really want to say on my half. I have to say that the most important transformational opportunity I ever had was to go to University of New Mexico School of Medicine. And as Val mentioned, I'm a small town girl. I always refer to myself as a country bumpkin. And so going to the University of New Mexico for undergrad and then for medical school was a wonderful opportunity, particularly since a lot of it was subsidized through grants and scholarships. And that's one of the reasons, probably the #1 reason that I want to give back, is that I received such a valuable education and wonderful opportunities. I had wonderful mentors, and my intention is to give back and be a mentor, an educator, and to the extent that I can inspire other young people from small towns to enter the healthcare field, I want to do that.
The Leonard M. Napolitano PhD Award, which Dr. Napolitano was the UNM School of Medicine's 3rd dean, as you know, from 1972 to 1994, and his many contributions include his commitment to getting to know patients as individuals, which led to the development of the School of Medicine's nationally recognized primary care curriculum. And the Leonard M. Napolitano PhD Award recognizes an alumnus who, like Dr. Napolitano, has built strong public and private partnerships while successfully advocating for and showing dedication to the School of Medicine and its patients through innovation and commitment to education.
Thank you so much. And Dr. Roth, when we say that this wasn't even a contest for this year's Napolitano Award, it really wasn't. When we think about Leonard Napolitano and his contributions, and when we talk about innovation and commitment to education, there's really no leader in the state for the last several decades who can compete with you and has amassed the CV that you have. And, you know, we can revisit that a little bit here. And you're not only a local leader and an innovator, but you're nationally respected in medical education, of course, in emergency medicine. You were our health sciences chancellor for 14 years, and dean of the medical school for 26 years. I certainly can account for some of those either lost hairs or gray hairs on your beard, you know, since you had to tolerate me for a full 7 years, got an extra dose. And we're particularly proud that you finished your family practice medicine residency from UNM here in New Mexico in 1979, and that's one of your definitely as an alumnus and part of the UNM School of Medicine alumni, you're one of our shining stars, and that graduating from our residency has certainly made us very proud to be associated with you. And you have worn so many hats during your career, starting the first urgent care, first time to kind of coin that term. I think it was the first urgent care locally here. And so you've worn that sort of private practice businessman suit, and that certainly gains a lot of respect from those of us on the private sector. Then academically, you know, you've done some incredible things from a social science standpoint in terms of the Center for Disaster Medicine, the countless victims and people that's helped. You've helped launch our emergency medicine residency program, and anytime any one of us is in dire need, we really have you to thank for making sure our emergency rooms are stocked with competent physicians. And so thank you on behalf of the entire state of New Mexico and all of our families for that. And your numerous national leadership roles inside of medicine, your liaison committee the Association of American Medical Colleges Council of Deans. You were the chair of that, so held so many high-level positions. And as far as continuing the Alumni Association's goals, you really have really expanded that by starting the La Tierra Sagrada Society and the numerous scholarships that's provided to our students and us on this call individually. And so we thank you for that. And I think obviously that's the CV highlights. And the one thing that we'll never be able to put into just full gratitude, Dr. Roth, is just how much you mean to us as alumni, as an educator, as a mentor. The highest level of respect that we could pay to anybody in medicine is the respect and gratitude of your colleagues, your peers, and that certainly is you. You're very, very well respected, not just locally, but nationally, because you've served as a mentor and a guiding light for so many of us. So thank you on behalf of the Alumni Association for being amazing, for an amazing 26 years of leadership as our dean. I'm going to ask Dr. Melendez to say a couple things as well.
Well, I think Dr. Roybal said it all, but Dr. Roth, we are just so proud of you to call you a colleague, a friend, a mentor, and a leader. And I'll just say that, you know, your leadership has been just an amazing example to many of us younger physicians who aspire to give back to our professions and to our communities. And you really have embodied that, and you're the epitome of an amazing physician leader that I hope to continue to aspire to be like. And so I want to thank you personally on behalf of the Alumni Association for just really your caring nature, always so positive. I've never seen you get upset once, and you don't have to tell me if you have, but I've just never seen you upset, and you're just so positive. So we want to continue that moving forward in our own leadership lives. You made a huge impact on our lives personally. And I will just share one story, if I may, an embarrassing story of Dr. Roth. No, it's not. But Dr. Roth, I remember when I was in medical school from 1996 to 2000, and I would look over there, and you were working in the emergency room. And I heard that you continued to not only serve in these leadership roles, but you still work those front lines in the emergency room. And I think that's a class act. That's a leader that's leading by example. And I'll just leave you with that. We just want to say thank you for that great example, for leading by example. We hope to really continue your legacy in that regard. So thank you so much.
Thank you.
And as representatives of the entire alumni body from the UNM School of Medicine, although you're stepping out of the limelight per se in retirement, although I'm not sure what you're going to do next, it may be extraordinary and directly in the limelight. However, do know that we consider you to be family, and if you ever need anything from your fellow alumni, we would be honored to take a phone call from you.
Thank you.
Well, it's just an absolute pleasure and honor to recognize you, Dr. Roth. You've recognized us, you've taught us, you've mentored us for so many years, and it was just a great ability of the Alumni Association to turn that around and put the focus on you. We want to thank you, we want to recognize you, we want to honor you, and we're just so happy and pleased that you were able to join us, and we thank you so much for the many, many years of service. I am wearing my 50th anniversary UNM, and if we all remember, those were wonderful festivities. You led us just amazingly through that process, and Martha did as well. So just so many kudos and warm feelings and heartfelt appreciation for you. So thank you so much.
So I am delighted to be here to honor Dr. Roth. It's usually him that gives this award, and this is my first year doing it. So it seems full circle in many ways for me. And what three great folks to say hello to the guests here, three of our really successful physicians that we're really proud of everything that they're doing in the community. So thank you all for being here. Paul, you have been amazing over these years. I know that Dr. Roybal talked a lot about some of the things you did, but I wanted to say a few more things about them, and maybe some of them a little more in detail. Of course, the disaster medicine assistance team, you've done an incredible job. I mean, we always think about you as New Mexico, but you have done that during the 9/11, the World Trade Center. You've been to Haiti. You've been all over the world and been a leader in how do we respond as human beings, as an institution, and as a country to our fellow man around the world. And so I know that you're proud of the work you've done in that, and you definitely should be. So many things have sort of been built up, and while part of them are the buildings, and I can talk about those, it really is your spirit within the buildings that's made the huge difference here. We've got the CTSC, we've got the Cancer Center, we've got the Domenici buildings, we've got the Barbara and Bill Richardson Pavilion. It is really remarkable. And now we have a new tower coming with 96 surgical beds. That really is the culmination of your work over several years. Those things are amazing, and our campus looks totally different because of you and really feels different because of you. Over the years, we've increased our research funding. We've had our highest years ever over the last few years. We're up to $206 million, I think, last year, which is a record for us, and we seem to be going higher and higher. The things that I'm particularly proud of is really the work in education. You have had so many innovations in education over the years, and we've always sort of been at the forefront of that. And I would be so remiss if I didn't mention the BAMD program, which really takes New Mexico natives, mostly from rural and underserved populations, who are now serving New Mexico as physicians, and we are so proud of that. That's made a huge difference in our world. I could name a million things. Our learning communities, where we create these families for our students, our new learning environment office. And I think Nate mentioned the Council of Deans, but really I think one of the biggest places nationally where your leadership has shown forth is through the Liaison Committee on Medical Education. For folks who don't know, Dr. Roth really worked on setting the standards for accreditation for schools of medicine that now include things not just like knowledge and skills, but really things like diversity and inclusion and things that make a difference in our world. And so those are important things to know about. My favorite things, though, about Dr. Roth are the times that I get to sit with him alone and chit chat about all kinds of things. Sometimes I cry, you know, it's all that. But it is really fun to talk about our experiences, to talk about our patients, to tell patient stories. We've shared patient stories that have made us laugh and made us cry, both. Really to talk about our families. And I think that Dr. Roth is a real example of how we can be good family all the time. I think that Dr. Roth leads by example. He walks the walk. He's made this state healthier. And everything I do in my job right now, I've learned from him. I'm very lucky that he stayed on at 25%. He is actually a learning community mentor. And though Dr. Roth had three roles as CEO, chancellor, and dean, I personally believe it's the dean role in education he loved the most, and he can't tell me otherwise. But he's now teaching medical students again. He's a mentor for learning communities, and his other 5% is my personal confidant and mentor as the interim dean of the School of Medicine. So, Dr. Roth, nobody deserves this award more than you. And on behalf of the University of New Mexico School of Medicine, I'm pleased to present you the 2020 Leonard M. Napolitano Award. Congratulations, Dr. Roth, and would you like to say a few words?
Well, that's really incredible. Thank you so much. Just a few comments. I'm really humbled by this award to a large extent because I knew Leonard Napolitano very, very well. And probably the first memory I have of direct contact with Leonard was back in 1981, when the chair of the Department of Family, Community, and Emergency Medicine, it was a combined department at that time, appointed me as the division chief for emergency medicine. And so after a full day of work in the clinic. I got home, I finished dinner, and then I got this phone call from Leonard congratulating me for having been appointed to that new position. And obviously subsequent to that, as was mentioned, I served in a number of administrative positions under Dr. Napolitano. His legacy really was one in which he built these relationships, as Ashley had mentioned, and particularly with the New Mexico legislature. And because of those relationships, he was able to grow the medical school, and it flourished substantially under his leadership. And, you know, we all know the saying that we all stand on the shoulders of those who went before us. And there really were no stronger or broader shoulders for me to have had the advantage of standing on than Leonard Napolitano. And so Nate and Rob and Dion, Martha, Ashley, thank you so much. The entire Alumni Association, thank you. This is a very meaningful award for me, and I really thank you so much.